no further ado, I'd like to introduce you to the wonderful Dr. Ethan Russo.
Well, thank you. It's a great pleasure to be here. I'm afraid we're going to be moving from the sublime to the ridiculous, but I don't disagree with any philosophy you've heard so far this morning. I come to you certainly as an icon of the establishment, but that is not the way I feel. I also may be dressed in a suit, but in my heart I'm wearing hemp. Anyway, my email is here. Those of you who know me will admit that I answer my email, so please feel free to take that down if you have subsequent questions. And I may be busy, but I will get back to you. So, of course, we're talking about the plant Cannabis sativa, cultivated cannabis, and how this works. Among other things, it relates to the endocannabinoid system. So we have this plant, wasn't put on God's green earth to get us high, because the plant has been around a lot longer than the human species. But through a convenient accident of nature, it makes chemicals that react with our own receptors. These are cannabinoid receptors, CB1, the psychoactive receptor, and CB2, an immunomodulatory and pain-relieving receptor. The reason this works is one chemical in particular in cannabis, THC, resembles natural cannabinoids within us, the endogenous or endocannabinoids. Best known, arachidonyl glycerol, anandamide, and 2-AG. These bind to the receptors in the same way that THC does, and the endocannabinoid system is composed of those endogenous chemicals, these receptors, and the enzymes that make them and break them down. Now, there's been a great deal of confusion about what we should call cannabis. Beyond the hundreds of slang terms, frequently you'll hear this is indica, this is sativa. In my opinion, this is all nonsense. We could go into the nitty-gritty of what is a species. We know that all cannabis can interbreed. What you really need to know is what's in it and what will its effects be. Of course, that depends to a certain extent on the internal milieu, the set and setting, these ineffable things that we try to affect. But it is important to describe the plant. What does it look like? Is it tall? Is it short? Is it broad-leafed? Is it narrow-leafed? More importantly, what are its components? Not just the cannabinoids. We're going to talk today a great deal about cannabis as beyond THC, the other components that synergize and, if you will, really make it a gift to humanity rather than a bunch of chemicals, which is the way it's going to sound as I describe them. We need to know the terpenoid content, the essential oils that give cannabis its unique scent. We also need to know the smell and taste, and most importantly, the effects that it might provide, particularly from a therapeutic standpoint. One manner of classification that I found most useful is this one that comes from NAPRO research. And if you concentrate on the panel on the right, you'll see that there are a number of sections that describe the percentages of the cannabinoids and terpenoids, their proportions, a picture of the bud. And then in the third panel, you see something interesting. Other plants, in this instance, a lemon and some peppercorns. Well, why is that? It is because the terpenoid content of limonene from lemons and caryophyllene from black pepper are also common to cannabis. Also in the third panel, you see nice colored wedges that give an idea of what people have reported in terms of the effect that this has had. And left third panel, you see a description of the smell and taste when it's inhaled, preferably by vaporization. The bottom panel is most interesting to me because I think the terpenoids have been ignored, and these are really the refined aspects of cannabis that give each type a chemovar, chemical variety, sometimes misnamed strains, give them their unique attributes. In this instance, you'll see it's very high in limonene. This is likely to produce an effect as an antidepressant and bright agent. And the caryophyllene, the blue, very high. This is going to be an agent that affects CB2, produces anti-inflammation, and reduces pain. Also at the bottom, you see a very narrow purple bar. This is myrcene. Myrcene is usually predominant in most chemovars of cannabis and is responsible for the couch lock and sedation that is all too common with most commercial types of cannabis. But there's so much more than that. As we follow through this panel, which comes from an upcoming book chapter that I did with Jehan Marcoux, we move from the plant into the leaf to the unfertilized female flower, and particularly in the upper right to its trichomes, the real action area of the cannabis flower where the cannabinoids and terpenoids are produced. But beyond that, we have the beautiful chemistry of the seeds, even the sprouts, as we'll get into. And then the roots. The roots have none of the same chemicals that are in the flowers, and vice versa, but they also have remarkable healing power that heretofore has been largely ignored in modern societies. The chemistry part. So these are the phytocannabinoids, the plant cannabinoids, and you'll see a bunch here. Most familiar are going to be THC and cannabidiol, but there are all of these depicted here have had sufficient investigation to know what their pharmacological effects and what their therapeutic effects may be. And this is the biosynthetic pathway by which the cannabinoids are made. We're not going to go through in detail. We're going to focus on one precursor, one of the parent chemicals, geranyl pyrophosphate. And as you see, this is a parent chemical not just to the cannabinoids, but if you follow it to the right, it also is a parent compound for the terpenoids. So the cannabinoids and terpenoids are half siblings, and as I like to say, unlike in some blended families, they get along beautifully. Let's talk a little bit about THC. Of course, this is going to be most familiar to you, and there are many people and governments out there that would like you to believe that all the pharmacology of cannabis relates to this one chemical. This is so far from true. If it were true, in 1985, cannabis would have disappeared because synthetic THC, as Marinol, became available. And anyone who has taken it will tell you it's a lousy drug with no therapeutic index. The difference between the amount that will produce benefit, perhaps, on symptoms and the amount that produces side effects is negligible. They're like this. With cannabis, it can be like this, a huge margin of safety under the right conditions. This does bind to CB1 in the brain and elsewhere. It, of course, has pain-killing properties directly. It's also a bronchodilator. It opens up the lungs, and there used to be cannabis cigarettes for asthma. The smoke part wasn't helpful, but the THC was. Beyond the receptor activity, it's a very strong painkiller and anti-inflammatory, 20 times the anti-inflammatory capacity of aspirin and twice that of hydrocortisone. It also is a muscle relaxant. That's the basis for its approval as Sativex as a prescription medicine in Canada and 28 other countries around the world. And of course, it's an antiemetic, particularly in situations like chemotherapy. And we're going to spend more time on cannabidiol. THC gets one slide today. I think we've got 4 on cannabidiol. So this is non-intoxicating. You may hear it's non-psychoactive. That isn't true because it does affect the brain. It's an anti-anxiety agent that can counteract the effect of too much THC. It's also an antipsychotic. There have been now 2 phase 2 clinical trials of either CBD alone or as an extract in treating schizophrenia with less side effects than conventional medicines. It has a very interesting property. It doesn't bind to the CB1 receptor, but when it's around, even in tiny amounts, it antagonizes the effect of THC. Now, that may sound like a bad thing, but it isn't. What it's doing is counteracting some of the less desirable effects of THC while also boosting its pain-killing and anti-inflammatory properties. It was recently discovered that it does this through being a negative allosteric modulator. This is a way of saying it's not binding here where THC does, but over here. And maybe it produces live long and prosper, the two together. I don't know. I just made that up. But you've heard it before. All these things come back. It is a neuroprotective antioxidant, and it's much more powerful than vitamin C or vitamin E in this regard, and may in the future be used under conditions of insults to the brain, whether it be strokes, head injury, etc. It also is what's called a TRPV1 agonist, like capsaicin, the active ingredient in chili peppers. And so this is important in treating a number of neuropathic pain conditions. One of its primary effects over time may be that it is a modulator of the endocannabinoid system. It boosts the amount of endocannabinoid, anandamide, and inhibits its breakdown. And over time, this may be a very powerful effect. It is a very strong anticonvulsant. I expect that Epidiolex, which is a predominantly cannabidiol extract, will be FDA approved later this year. The problem will be when we see what it costs. That remains to be seen. As mentioned, an anti-anxiety agent. In high doses, CBD shares with the other cannabinoids a unique ability to selectively kill cancer cells while being preservative for normal cells. So this is exactly 180 degrees from conventional chemotherapy, where it's generally toxic and you hope that you kill the tumor before you lose all your hair or your gut lining. So this really needs to move forward. Additionally, it has a wide variety, another 25 mechanisms of action that account for it being a strong anti-inflammatory. Additionally, how it works as an anti-anxiety is mediated through serotonin, as are a number of other effects, including disturbances of thinking in advanced liver disease. Potentially, it could interfere with slow viruses, mad cow disease, and things of the like. There is not the likelihood we'll ever have a clinical trial in those disorders because, fortunately, they're pretty rare. A recent one that's interesting is that CBD promotes bone healing, and in the future, it may be that this heretofore forbidden drug is used to treat athletes that break limbs in sports. Now, there are a lot of misconceptions about CBD, and I've recently written an article specifically addressing those misconceptions. One is some purveyors will say, oh, it's got 0.5% CBD, as if that's a great thing. This is a wonderful compound. However, it's not potent. That's a way of saying you need a good amount of it to exert these beneficial effects. We've already addressed this one. It is psychoactive. It's non-intoxicating, if, for lack of a better word. You will commonly hear that it's sedating. It is not. Pure CBD is actually quite alerting. The problem is that most chemovars that have cannabidiol in any amount also are very high in myrcene, the couch-lock factor. And so this has created a misconception there. And we have proof with EEGs and the like that this is an alerting molecule. South of the border, you'll commonly hear some of the hemp-based CBD purveyors claim that it's legal in all 50 states. It isn't. It is illegal in all 50 states. It's just that the law has not been prosecuted. I didn't say the way it should be because I don't believe that at all. But if you want to know what the law actually says, it is illegal. The problem being that the Controlled Substances Act allows hemp stalks and seeds if they're clean, but once you go and extract chemicals from them, it is an exception to the exception, and they're illegal again. Another one, and this came up last year in an article where they used simulated gastric acid, exposed CBD to it for an hour, and got some of it to turn into THC. This does not happen in your body. It doesn't hang around for an hour. Even though this reaction has been known since 1940, it does not occur in the human body, and you have no enzymatic equipment to convert CBD into THC. This shows some of the same things, the natural history from the hemp plant down to the pure crystalline chemical. And as you see in the last part, your body converts it into something else, 7-hydroxy-CBD. It doesn't convert it into THC. You can do that in the test tube. Now, an agent you may have heard less about, tetrahydrocannabivarin. This is present in small amounts in cannabis from southern Africa, South Africa, Zimbabwe, etc. For a long time, it wasn't known how this worked, but it's an interesting chemical in that at low concentrations, it's an antagonist at CB1, what's called a neutral antagonist. So it's quite different to rimonabant, the weight loss drug that was subsequently yanked from the market because of horrible side effects. That actually knocks down the activity of the endocannabinoid system. This just occupies space in the receptor and would allay hunger and help with the metabolic syndrome that is affecting so many people in Western societies. So it has been shown to produce weight loss in the obese. It's also a strong anticonvulsant and also a painkiller. So unfortunately, aside from GW Pharmaceuticals, which has a plant that has 92% of its cannabinoids as THCV, there's nothing analogous elsewhere, but this could come about with selective breeding, not with genetic modification, to which I'm totally against. Moving back for a second, THCV is like THC, but with a 3-carbon side chain instead of 5. So that brings us to CBDV, cannabidivarin. It is like CBD with a 3-carbon side chain. This is an interesting anticonvulsant. You know that CBD is an anticonvulsant. This works on a different type of seizures of partial onset, focal seizures. And it may be that the two together are going to make a better drug as presented in the plant. Now, you will also hear a lot about the raw acid cannabinoids. So what the plant generally makes is not THC, but THCA, tetrahydrocannabinolic acid. Some will convert into THC in the plant. If we look carefully at literature of the past, there were a lot of medical uses for raw cannabis that wasn't decarboxylated, where you lose the CO2 group on the molecule. And this largely revolved around its anti-inflammatory properties and abilities to treat tumor. It does something that THC does not. It affects something called tumor necrosis factor alpha that's very important in certain autoimmune diseases, inflammatory bowel conditions, also rheumatoid arthritis. Then it's also been used successfully in small amounts to treat seizure disorders that haven't responded to THC or CBD predominant preparations. Now, why this isn't clear, because there's a lot about this we don't understand. It seemingly does not cross the blood-brain barrier, that filter system that keeps toxins out of the brain. But we know in seizures that breaks down, and maybe it just gets in to the extent it needs to in people that have that kind of problem. Also, it's unclear whether this binds to that CB1 receptor. Some experiments have said yes, others have said no. It's an inherently unstable molecule, and so if it converts to THC, you're going to get some spurious results. Bottom line, more study is needed. So it has a counterpart in cannabidiolic acid, CBDA. So this is what CBD looks like before decarboxylation. This is a natural herbicide. Hemp retting ponds were infamous for producing good weed killers, also killing worms and things of this sort. It seems to be an extremely powerful antiemetic against nausea, about 100 times more powerful than CBD. So again, it looks also, based on the historical literature, that this was a very, very effective agent in treating tumors. If you look at the Renaissance herbalists in Europe, they were always discussing raw hemp as a treatment for tumors. So a great deal more work needed there. This is taken from a 2011 article called Taming THC, and you see again a number of different familiar plants that depict their representative scents that are also found in cannabis. Basically, the terpenoids are antibiotic, anti-inflammatory. They're often things that work on emotions and synergize with THC. Monoterpenoids are the ones with 10 carbons, and you'll see that there's some different structures, but what they have in common is this 10 carbon structure, no nitrogen, and all odoriferous, very powerfully. And we'll talk about some. Now, there's a lot of fine print here. I did this to try and impress, but we're not going to read all of these. What I want to say about alpha-pinene is it is much too little abundant in modern cannabis chemovars. A lot of people, particularly people my age, the gray hairs, will wax prosaic about the cannabis of the past because, remember that strain, the one where you could smoke as much as you like and still have a clear head. Well, there isn't much of that around these days. And the reason is a lack of pinene. Pinene is an acetylcholinesterase inhibitor. Acetylcholine is the memory neurotransmitter in the brain. So if it's broken down too rapidly, you forget. What was I saying? That, okay? That's fun if you need to forget how lousy a day you had at work and what a prick your boss was. But under other conditions, if you're in pain and have to work or study, you need this to counteract that short-term memory impairment. So in addition to that, it's really a phenomenal antibiotic, broad spectrum. It's just great for clearing the head. The Japanese have a wonderful term for this. They call it Shinrin Yoku, which is called forest bathing. And for anybody who has the fortune, as most of us do, to live in the Northwest, when life gets you down, you need to take a walk in an evergreen forest because that pinene in the air is going to clear your head. All right, next, myrcene. This is a very useful molecule if you need to sleep, and it does have analgesic effects. It actually is a very narcotic-like effect. So this produces a pain relief that responds to naloxone. Naloxone is the opioid blocker, the same thing they give on the street on the east side to people who've overdosed on heroin or fentanyl, okay? But this is all too prevalent due to modern breeding techniques and produces this couch lock that, again, some people like that, a lot of people don't. And again, if you have to work or study, it's just not conducive to that. Limonene I've mentioned before. Again, this was more common in the olden days, but certainly can be brought back. You've all experienced this. If you walk down the aisle in the supermarket, there's a bunch of artificial limonene in there because psychologically we equate this with cleanliness and bright thoughts. But that's not just psychological, it is biochemical. You can do the same thing by running your thumb on a citrus rind of any variety, and you'll get that. But this is a very powerful antidepressant. In Japan, they did an interesting trial, hospitalized depressed patients. They cut their depression scores in half, got most of them off of their standard antidepressant drug regimens, and it's also a very powerful immune stimulant. It has some other effects that are still being explored on a thing called adenosine A2A, where THC and CBD both work, but through different mechanisms. There's some kind of synergy going on there that I, with my colleagues, are exploring now. Linalool. This, again, may be familiar for those of you who still have grandmothers who may have had lavender for its various beneficial properties. Very powerful anti-anxiety agent, also spectacular local anesthetic. If you cook, you should keep a bottle of lavender essential oil in the fridge. When you get a burn, just put it on neat, cover it with an ice cube, and the pain will be gone in a few minutes, and there's almost no chance it will blister. It also is a powerful anticonvulsant. We've now had documentation from my colleagues Dustin Sulak and Bonnie Goldstein of presence of a small amount of linalool in given chemovar, producing the key difference in the ability to control seizures in children taking cannabis for its treatment. So we move on to the sesquiterpenoids, and we're only going to discuss one today. These are 15 carbon molecules, a little bit higher molecular weight. Foremost among these is caryophyllene, which is often the predominant remaining terpenoid in extracts, which tend to burn off the monoterpenoids. Now, it's been known for a long time that this is a very powerful anti-inflammatory agent, but unlike all the non-steroidal drugs out there that produce ulcers, this is a gastroprotective. It actually prevents that kind of involvement. It was only 10 years ago that it was discovered that this is not just a terpenoid, but a cannabinoid as well, because it works selectively on that CB2 receptor, the non-psychoactive receptor that mediates inflammation and pain. So what we've got is in the pharmacology realm, there are a bunch of companies working on synthetic CB2 agonists that would do the same thing. But they've all failed, mainly due to toxicity. Modern pharmacology usually rests around identifying a receptor, using a computer to design a molecule that will lodge there with the highest affinity and highest potency. You work on it for 7 years, spend $600 million, and find out that it causes aplastic anemia or liver failure or something else. That's backwards. Rather, plants have been medicine for almost all of our history, just 100 years, where we've decided in our hubris that we could do it better than nature, and I think we've been wrong for the most part. This also appears to be an agent that could fight addictions to other substances. We know from animal work with synthetics that rats who are trained to be addicted to cocaine will stop pressing a lever to get it when they're exposed to CB2 agonists. So we could do the same thing with caryophyllene, dirt cheap, and with no risk of those toxicities. So we move on to what I like to call the cannabis odds and ends, and there's a reason for that, because the tops and bottoms are involved. Again, a lot of fine print here. Friedellin is a triterpenoid, a 30-carbon molecule. None in the tops, just in the roots. So this is a very powerful anti-inflammatory agent. Again, not one that's going to be prone to all the side effects of the non-steroidals. And it's shown benefit against a number of cancer cell lines. This is particularly intriguing, although the roots don't make a tremendous amount of this. We know it must be working because there are any number of people, particularly Natasha Riz, who's going to be speaking to you later, that are using this in artisanal preparations to great advantage to treat skin inflammation and other disorders. It also can be taken internally. This is really intriguing to me because as it is, we're throwing this stuff away. So we have a neglected herbal resource of possibly great value here. Similarly, there's an agent you probably haven't heard of called Cannabis, another potential anti-inflammatory agent that is in a fair concentration in the leaves. And for those of you taking pictures, all of this is going to come out in that article that will be published in August. So if you want to contact me then, we'll get you the key information. And we shouldn't forget the seeds. Mostly we're dealing with Sinsemia ganja, the unfertilized female flowers, but when allowed to fertilize itself, it makes this wonderful seed, which is probably the most complete single food on earth in that it has a digestible protein, edestin, and perfect balance of omega-3 and omega-6 essential fatty acids. If you had to pick one food upon which to survive, this would be a good choice. Now, interestingly, when you sprout it, other things happen. Canflavin is what's called a flavone, an anti-inflammatory chemical that was discovered about 25 years ago. It's never going to be developed as a drug because canflavin A is too hard to separate from canflavin B. So to purify, it's too difficult, which is good for us because it raises the possibility that it could be used as an herbal agent. And it's been discovered that when you sprout this, you increase the amount of canflavin. And if you have the right chemovar cannabis, it's not yet producing cannabinoids, so it might be legal in a number of jurisdictions. So this is a very promising agent for the future. Again, not affecting COX-1 or COX-2 with all their side effects to produce ulcers, strokes, and heart attacks. To finish up, I want to give you some examples using the phytofacts and what they can do. Now, this is a type 1 plant. THC predominant. This is mostly what is available out there in the realm of cannabis commerce. But this one's called type 1 pinene, and the reason is you see the big green bar. So we have an agent very rich in THC, but yet low in myrcene, low sedation, high in pinene, not having that short-term memory impairment. And so if you needed THC to treat your muscle spasticity, spasms, or pain, good choice. Type 2 plants have roughly equal amounts of THC and CBD. This is the way cannabis used to be before selective breeding for the recreational market made it all type 1. Now this one's high in limonene. It's got a lot of CBD, which is good for inflammation and burns. The CBD is good for epilepsy. It's also high in linalool, which is the sort of violet bar down there. So burns and epilepsy, what do they have in common? I guess it's the need for this type 2 legend. Type 3 plants are high CBD and low in THC. This one, because it's very high in caryophyllene and has CBD predominantly, would be very good for pain, inflammation. Being high in caryophyllene, it's also good to treat addiction. So again, these are things that seem very disparate, but have in common the need for these various components. This is another type 3, CBD predominant. And because it's very high in limonene and low in sedative aspects, it should be very good for treating depression and anxiety. It's got a fair amount of linalool. Another type 3, this one I'm really excited about because it's not only rich in CBD, it's got a good amount of CBDV. So it should work on generalized seizures and seizures of partial onset. The caryophyllene will provide reduction of inflammation, and the linalool will also contribute to it being an anticonvulsant, what we call a wide spectrum anticonvulsant. It should work in most of the many kinds of seizures. And finally, I wanted to show this. Going left to right, we have a type 1 plant, high THC, type 2 in the middle, equal amounts of THC and CBD, and type 3, predominantly CBD on the right. If you look at the terpenoid bars at the bottom, they look the same in each one. So this, having the ability to compare these in patients would really tell us a great deal about what the contributions are of the different components. We're keeping one side the same, and we're altering the balance of the cannabinoids. So this is very promising for future clinical use. And I hope I haven't exceeded my time. I'm happy to answer questions. I know it's your break time. If you need to leave for any reason, please do so with no hard feelings. Thank you for your attention.